It's a great day, Medical Monday. If your teeth don't hurt, then everything should be fine, right? Well, not exactly. Plenty of problems could be lurking underneath that million-dollar smile. That's why it's important to stay on top of your dental x-rays. But how often should you get them? Dr. Terri Alani's Tooth Academy has the answer, along with 10 reasons to get x-rays. Welcome her to the show. Hello, Terri.
Hello.
Okay. So a lot of times people come in to see you, not for their regular visits every 6 months or at least once a year. They come in because, ouch, something
They have
hurts.
an emergency.
Yeah.
And the reason I'm bringing this topic up today is I want to tell everyone about the top 10 reasons that you must have dental x-rays.
Okay.
People always come in and ask. Now, first of all, we use digital x-rays. Digital x-rays are about 85% less radiation than your traditional x-rays, and the patient gets involved in the process. There are 3 types of x-rays when you go into a dental office. One is bite ring x-rays, which are the annual checkup x-rays you take every 6 months to a year for adults, and this is what they look like. Next slide. Full set of x-rays is really the set of x-rays that's taken on the initial appointment. It's required for a comprehensive exam, and we will go in a minute and explain why this is necessary.
Okay.
And then the last type of x-ray that you might take when you go to a dental office is called a panoramic x-ray, and that's an x-ray that is usually done by an oral surgeon to look for cysts and abnormalities in the jaw.
Okay. Now let's look at the reasons why things might be going wrong underneath.
Right here. First of all, impacted wisdom teeth. You cannot see these impacted wisdom teeth with the naked eye. So this is a panoramic x-ray that is necessary to see the impacted wisdom teeth and exactly their relationship to the rest of the jaw.
Yeah.
Very important. And number 2, eruption of permanent teeth. This is really important in children. You think, why do my kids need x-rays? Well, this is a child probably about 12 years old, 11 years old, and these are the permanent teeth. We want to see the relationship of the permanent teeth to the teeth that they're getting ready to lose, and how quickly that will happen. Number 3. Periodontal disease, very important. A lot of times we can't see that with the naked eye.
And the earlier you can get it, the better you can treat it.
Exactly, it's very treatable. This patient has a lot of tartar and also bone loss. So this bone loss is, you cannot see it unless you probe and you have an x-ray.
Okay.
Number 4, root tips. These are root tips that were lodged into the patient's jaw. This is the upper maxilla. These are the sinuses, so it's real important that we see the relationship of the root tip to the sinus when we go to take the tooth out, that there are no complications.
Okay.
Number 5, tooth decay near the nerve. Now, this might be difficult for your viewers to see, but there's a really dark area here. This is a huge cavity, which you might not be able to see how deep it is.
Might not feel.
Exactly, and here's the nerve. So we want to see, wow, does that teeth need a root canal, or what type of precautions we have to take to prevent that root canal.
Just a filling or a root canal. Okay.
Exactly. Number 6, non-visible tooth decay. Now, this is an actual root canal that's been completed. Don't look at that, but these are dark areas in between the teeth that are actually cavities that we cannot see unless we actually take x-rays.
Yeah.
Number 7, abscesses. This patient came in, had large abscess, had no symptoms whatsoever. We would never have seen this without an x-ray.
And that can cause infections and all kinds of other problems.
Exactly, infection, and we ended up doing a root canal, and this will actually get better over time.
Okay.
Next one. Implants. A lot of times we'll see patients that have implants. You cannot tell they're implants when you look above the gum line, but you take the x-ray, you can see the implant and make sure that it's sealed here and there's no complications.
Okay. And
next? The next one are cysts. A lot of times patients will have cysts or tumors. This might be a difficult slide to see, but there is a huge cyst right here, which would never be able to be detected with just visually looking at the patient's mouth.
Yeah. And then finally, the orthodontic treatment plan is another.
And also, yes, we take x-rays for orthodontic treatment because we want to be able to see exactly how we're going to straighten the teeth and to see the roots and the movement that's necessary. And those are the top 10 reasons you need dental x-rays.
Dr. Terri Alani's Tooth Academy. I always wondered how you're able to really read those x-rays. All right. We've got an audience member, Parker, here, who wants to ask you a quick question about dental care. Hi.
Hi. Hello. What toothpaste should I use?
Any type of toothpaste is good as long as it has fluoride in it. How old are you?
11.
11. Just make sure that you brush your teeth properly, and you want to make sure you brush your teeth really after you eat. So that's really important. And get dental checkups.
Yes. Tell mommy and daddy to take you for your dental checkups all the time, all right? And dental checkups should be twice a year?
Twice a year, especially for children. And children should have x-rays every 6 months to make sure that we can detect decay properly.
All right, Dr. Alani, thank you very much. And Dr. Alani has a special offer for new patients. Mention Great Day Houston, and you'll get half off your next x-rays and dental exam. To set up an appointment, call 713-621-5141, 713-621-5141, or go online to TexasToothLady.com or Facebook.com/Terri Alani DDS. Plus, tune in at 6:50 a.m. Saturday mornings at 9 a.m. to hear Dr. Alani on her radio show For Your Health. Thanks again.